Principles of the maxillary occlusal projections. Three main principles that we should keep in mind when we are taking the maxillary occlusal projections are: 1. The receptor's flat side is facing the arch that is being exposed. 2. The receptor is placed in the mouth between the occlusal surfaces of the maxillary and mandibular teeth. And 3. The receptor is stabilized when the patient gently bites on the surface of the receptor. There are three maxillary occlusal projections that are commonly used: topographic, lateral, which is right or left, and pediatric. The occlusal projection is used to examine the palate and the anterior teeth of the maxilla. Lateral right or left projection is used to examine the palatal roots of molars. Pediatric projection on the maxillary arch is used to examine the anterior teeth of the maxilla and is recommended for the use in children 5 years or younger. When we are exposing maxillary topographic occlusal projections, we have to make sure that the patient is positioned such that the maxillary arch is parallel to the floor. Technically, size 4 film is used and is recommended for this type of exposures. In our clinic, we will use size 2 receptor with a flat side of the receptor facing the maxilla and the long edge in a side-to-side direction. Insert the receptor into the patient's mouth, placing it as far posteriorly as the patient's anatomy permits. You can leave the receptor a few millimeters visible, so when you place in the PID, it helps to avoid the cone cut. Instruct the patient to bite gently on the receptor, retaining the position of the receptor in an end-to-end bite. Position the PID such that the central ray is directed at a positive 65 degrees vertical angulation towards the center of the receptor. So this means that the PID should be positioned such that the central ray is directed through the midline of the arch towards the center of the receptor, and that the top edge of the PID is placed between the patient's eyebrows and the bridge of the nose. When exposing maxillary pediatric occlusal projections, the same steps must be repeated. The only difference is the film size. In our clinic, we will still use size 2 receptor, but if you were using regular films, you will switch from size 4 to size 2. And the PID must be positioned such that the central ray is directed at positive 60 degrees instead of positive 65. When exposing maxillary lateral occlusal projections, the patient position should remain the same as with occlusal projections. Again, in our clinic, we are using size 2 receptor with the flat side of the receptor facing the maxilla and the long edge in the front to back direction. And we want to shift the receptor to the side of the area of the entrance. So for example, if we are trying to expose the right side, we will shift the receptor towards the right side. And if we are trying to expose the left side, we will shift the receptor towards the left side. The long edge of the receptor should extend approximately a ½ inch beyond the buccal surfaces of posterior teeth. So the PID is directed at positive 60 degrees in vertical angulation towards the center of the receptor. The top edge of the PID is placed above the corner of the patient's eyebrows.